This is Access Academy, and today we are talking about using a team approach in evaluating students with visual impairments using the Woodcock-Johnson IV Braille adaptation. The Woodcock-Johnson IV, adapted for Braille readers, is a product available through APH. This Braille adaptation is comprised of 3 tests which were able to be adapted for Braille readers. And each of these 3 batteries we're going to be discussing soon today. You can get it in uncontracted or contracted Unified English Braille. And it also comes in Nemeth and UEB Math Science. It is federal quota eligible. Presenting today is Lynne Jaffe, a lead consultant for the American Printing House for the Blind on the Braille adaptations of the Woodcock-Johnson. Her professional career includes 15 years as a learning disability specialist with the Arizona State Schools for the Deaf and Blind. She's also an adjunct assistant professor at the University of Arizona. She has co-authored 4 books on report writing for psychologists and diagnosticians. During our time together, you can expect the following. We'll identify skills and knowledge assessed by each battery, explain examples of test adaptations, and examine differences between the print and Braille adaptation that can affect validity of results. While we get ready to transition to Lynne's content, we invite you to take a moment to reflect and think about this question and answer it in our poll. Have you been involved with administering the Woodcock-Johnson using a collaborative team approach? Yes or no? And that collaborative approach is meaning that a psychologist and a teacher of the visually impaired are working together. So while you are doing that, we're going to let Lynne get set up in the background to do her screen share. And we will get up and running. Again, have you been involved with administering the Woodcock-Johnson using a collaborative team approach? And I can share that as of right now, we have sharing out the results. 65% of you are saying no, you have not had the chance to do this today, while 35% say yes, I've done that, meaning psychologists and teachers of the visually impaired working together. I hope that for the many of you who have not had a chance to do that, that today you will learn some new things today and be inspired to see the power of the team approach. And it looks like we are getting up and running.
Okay, do you see my slide?
We certainly do. The title slide, using a team approach when evaluating students with the Woodcock-Johnson IV.
Good, all right. Since I'm somewhat new to webinars, I'm not sure what everybody else there can see. Can they see me as well as what I have on the screen?
Yes, ma'am.
Okay, so to let everybody know, welcome to Arizona. I am not actually sitting in front of the Chiricahua Mountains, but it's a lot nicer view than my office right now. So welcome. I'm delighted that there are so many people who are interested in using this adaptation of the Woodcock-Johnson for students and others who are blind. I want to start with a quote, which is from Meyer. Tests do not think for themselves, nor do they directly communicate with patients. Like the stethoscope, a blood pressure gauge, or an MRI scan, a psychological test is a dumb tool, and the worth of the tool cannot be separated from the sophistication of the clinician who draws inferences from it and then communicates with patients and professionals. So Meyer's statement addresses the point of my talk today. If our tests are going to provide the information that we're seeking, we need to administer them in a way that is fair and interpret the results with knowledge of the student. Of course, we use the Woodcock-Johnson, and you would use the Woodcock-Johnson Braille for other people than students. You could, it's used for anybody up to the age 90s. And, but I think most of us here today work with students. So I'm just going to use that term rather than subject or examinee. Excuse me for a minute. I wanted to mention how I got into this. I had been working at ASDB. I had done a lot of work with the Woodcock-Johnson, and I had been asked to write the cautions and restrictions for the original, the WJ3, for people who had vision loss or hearing impairments. And so I think because of that, Barbara Henderson, who was the head of tests and measurements for APH at the time, got in touch with me, and she said, we want to do an adaptation of the Woodcock-Johnson for people who, this was the Woodcock-Johnson IV, for people who are blind. Would you work with us? And I said, I don't think that's possible. The adaptations would be too extensive, and I don't think you could do it in a fair way. And she said to me, people are doing it all across the country. They're just doing homemade tests. They're just, translating this into Braille or whatever. They're doing it anyway. And then she sent me an example. So here's the original. Is my pointer showing on the screen? Okay, I'm just going to assume it is. She sent me an example. So let's say the item is how many shoes are there? And the original item would have a picture of 3 shoes. And so what people were using were tactile graphics of a shoe. Now, if you think about it, touch a tactile graphic of the outline of a shoe. Does that represent a shoe to you? So asking how many shoes are there and feeling tactile graphics, you would probably say there are none. Or others were just brailing shoe 3 times. And of course, that is rather unfair. So when I looked at what people were actually doing, I called Barbara back and I said, yeah, I'm on board. Let's do this. So we did the Woodcock-Johnson III, just the achievement battery. And then when the Woodcock-Johnson IV came along, we decided to adapt all 3 batteries. So these were our goals. The purpose, the rationale was to provide measures to assess the cognitive and oral language abilities and the academic achievement of people who are blind, to provide one standard edition of the test, allowing comparison of scores with sighted and blind individuals nationwide. And I want to put a caveat here. We were hoping that at some point we would have enough scores on blind people to compare them. I don't think that's happened, and I don't think that research has been done. We certainly had a goal of using a well-respected and widely used battery with strong psychometric properties, which the Woodcock-Johnson is, and to provide an adaptation that retains the evaluative intent of each item, test, and cluster. And we'll be spending a lot of time on that today. And to provide the test as much as possible in accepted Braille test formats. So what's in this test for you, any of you who may not be knowledgeable or familiar with the Woodcock-Johnson? It has 3 batteries of tests. There's a test of cognitive abilities, tests of oral language, and the tests of achievement. The cognitive, and I just want to give you kind of an overview of what's in it, and then we'll move on. just in case there are people who are not familiar with the Woodcock-Johnson. So the cognitive battery assesses the performance on tasks that require specific cognitive abilities, such as short-term memory, working memory, logical reasoning, and general knowledge. And the idea is to assess the abilities that people need for school and work and tasks of everyday living. And I'm going to stick this in here because I wanted to make sure you had it in your handout. But this is true of every test throughout all three batteries. The evaluators are encouraged to interpret the results based on qualitative analysis of the responses as well as scores, keeping in mind that the scores reflect a comparison with cited individuals. This is just an example of how the battery, this cognitive battery, is composed. So instead of using the word composite, the Woodcock-Johnson uses the word clusters. So a cluster would be composed of a series of tests. So I won't go through all of these, but you do have them in your handouts. But as an example, comprehension knowledge is made up of the tests, oral vocabulary, and general information. Short-term working memory is made up of verbal attention and numbers reversed. But for an extension, if somebody wanted more information about short-term working memory, then they would add the test object number sequencing. Okay. Notice here, there's no cluster that shows IQ or general intellectual ability. Let's talk about that for a minute. We carefully looked at this and decided that it made no sense whatsoever to include the general intellectual ability for people who are blind. Individuals lose their vision at different times in their lives from a variety of causes, and many have concomitant disabilities at various levels of severity. The ensuing effects on the development of their cognitive abilities is likely to be complex and varied. Consequently, test results regarding narrow and broad cognitive abilities are likely to be helpful in planning educational and vocational programs for people who are blind. But a broad statement regarding their general intelligence is just not appropriate. So we have omitted the 3 WJ4 intellectual ability composites: the general intellectual ability, brief intellectual ability, and the GFGC composite. None of the tasks on any of the tests were designed for blind people. If you think about what's a very important learning modality for people who are blind, it's tactile and haptic, so major muscle movement and tactile. And there is nothing on the Woodcock-Johnson that tests that tests learning through those means. And as I mentioned, within the population of people who are blind, it's just not possible to establish average levels of cognitive abilities. And the research indicates that the developmental pattern of people who are blind from birth is different from that of sighted people. And so we just didn't have a standard to use for general intellectual ability. So the next battery of tests was oral language, and that tests a variety of oral language abilities, such as vocabulary knowledge and comprehension of short discourse and narratives, and memory for narratives, and word retrieval, And a basic reading related task such as sound blending. That's the, thought I turned that off, I'm sorry. I have meant to turn my phone off and I will right now. Okay. There is one test, the oral comprehension test that was translated into Braille. The WJ3 has 3 tests that are translated, I'm sorry, that are Spanish translations, but we only used one of those. And this is an example of some of the tests and composites of the oral language battery. And then the third battery is the achievement battery, and it includes reading, writing, math, and social studies. There are, on the original WJ4, there are tests of humanities and science, and because of the heavy reliance on pictures, we had to omit those. And these are some of the clusters and tests that are included in the achievement battery. Okay, so in general, what's our purpose in doing these assessments? Well, this was our focus. We wanted to provide a sampling of skills and abilities for information regarding an individual's present level of cognitive, oral language, and academic functioning, and to help identify the nature of any specific cognitive, oral language, or academic weaknesses or strengths. Provide a baseline against which to measure progress. So if we find there's a problem and we put an intervention into place, you want to know if actual progress is happening. And the only way to do that is to have a baseline measurement and then be able to measure any advances. And to provide educational and vocational planning, including interventions, modifications, and accommodations for low skills and abilities, or enriched education for particular strengths. There are plenty of people who are blind who are gifted and need enriched education. And we also want to make sure that if somebody is not keeping up with what we would expect, that we can figure out why and what type of interventions are necessary. So I think at this point, if there are any particular questions about what I've covered, go ahead and ask those questions.
There is one question I want to hop in and ask Lynn, and this goes back to when you had addressed on the slide about IQ scores being omitted.
Mm-hmm.
So what are suggestions for alternatives to use in place of IQ? Do you have anything that you would suggest? Because sometimes people are mentioning that in the IEP process that certain documentation needs to occur. So what are suggestions for alternatives to use in place for IQ? Do you have any input?
Yes. I don't believe in what we call G. I don't, unless all of somebody's cognitive abilities are exactly the same, there's no way to talk about them as one thing, one cognitive ability. So I think that doesn't make sense in the first place, and there are plenty of people who agree with me, and then there are people who don't. But this is something that is a constant discussion among people who do research in cognitive abilities. I think it's much more important to look at the various abilities that make up, or that would normally make up, one score, one IQ score, or what we call the GIA, the general intellectual functioning, and look at the different parts of that. I'm going to go back for a minute, if I can, to show you this. Okay. Comprehension knowledge is really crystallized knowledge. It's information that a person has learned, that they have actually, explicitly learned. So it's their vocabulary and what they know about the world. That's one piece of intelligence. Another piece of what we call intelligence is working memory. How well can you use your memory as a scratch pad to perform tasks? Another one is how well do you process information that comes in that is not necessarily oral language based in terms of words. So like how well can I do process information that are not words but come in through the sounds of the language? What about how auditory memory span? How much of a length of a sentence or words or digits? How much of that can I hold on to? Or how well can I reason with numbers? How well can I reason with new novel problems that are presented in words or presented visually? All of those go into an intelligence score. And really, almost nobody has all of those things or all of those abilities at the same level. So if we want to take one that's really high and some that are really maybe an average range, and then we average them out, does that really tell us anything? So, in all of the time that I've worked in this field, the only time we've really had to use a GIA is if we want to get somebody a diagnosis that the Department of Economic Security will pay for them to get help. In other words, intellectual disability at a specific level. Otherwise, if you have to go for, and give a GIA for giftedness. But I think if you have a person who's blind and what you are looking at, or the standard is that you have to give one score, I would just argue against it because it's just not valid. That's the best I can do because you're just not going to get it from this test. I mean, you could just average all of the cluster scores yourself, but it wouldn't be valid. So I'm sorry, that's not exactly probably the answer you wanted to have, but that's the best I can do with it. Okay, so now I have to go back and find out where I was. Okay. So let's look now at what is kind of the meat of this presentation, which is what are the key principles? What did we use as principles for adapting standardized tests for Braille readers, and what are the adaptations? So we had 5 principles that, as we worked with it, we created, or these principles kind of showed themselves in adapting a standardized test, a test standardized on sighted people for Braille readers. One was test integrity, and this is a big one. We needed to retain the assessment intent and the task demands of each item and each test. We needed to replicate the standardized administration procedures. We had to make some decisions about Braille format. The Test had to produce scores with a consistent value across all test subjects, which certainly wasn't happening with these homemade tests. And we realized that it had to be a team administration and interpretation. It had to be a TVI who was working with the student and whoever the primary, what we're calling the primary examiner, the psychologist or the diagnostician, who normally does this test with sighted individuals. We're going to look at each one of these principles separately. And the first one is test integrity, because this got to be really the most complicated. In order to do a fair adaptation and to use the norms, we had to retain the assessment intent and the task demands of every item and every test. And so we asked the following questions of all the items in all 50 tests on the Woodcock-Johnson IV. And, you know, at one point I knew how many items that was, but I can't remember and I couldn't find where I wrote it down. But it was a lot. So first, what skill or knowledge is this item intended to assess? Does the item contain any elements that appear to be extraneous, but they're intended to be identified? Does the item contain elements that are unrelated to the task and present an unfair complication? And then would an adaptation change the task demands, thereby requiring a different or more advanced skill, knowledge, or cognitive ability? More advanced skill, knowledge, or cognitive ability than we are asking of a sighted person. And E would be, what foundational skills, knowledge, or experience does the performance of the task assume? So I'm going to give you an example. So looking at this math problem, what specific skills is this math problem intended to assess? And does it contain any extraneous elements that are intended to be identified? So here's the problem. Bill has 23 plants in his garden. Mary has 15 plants in her garden, and Donna's garden has 20 plants. How many more plants are in Bill's garden than in Donna's garden? So if you can figure out what skill or knowledge an item is intended to assess, you know what to adapt, and you know what attributes you need to retain. So this kind of task, the skills that it's intended to assess is one, the ability to translate a word problem into a computation problem, which is subtraction, and then recognition of extraneous information. We don't care how many plants Mary has in her garden, but there's a reason that that information is in there. We want the student to be able to identify what is and what is not related to the task. So when we Braille this and when we adapt it, we want to keep that element. Actually, there's no adaptation necessary except putting it in Braille. Now let's look at this one. And this is an actual item from the test. So we're still looking at test integrity, the third part of that. Does the item contain elements that are unrelated to the task and that present an unfair complication? So the question is, how many dogs are there? What do we want to know? We want to know, can the person count? But this array is really spatially confusing. And if we tried to do something with it and kept this spatial array, it would definitely be unfair to somebody who's trying to use their hand to find the different pieces of it. So what we're assessing here again is the ability to count, but also the ability to recognize and ignore extraneous information. But the elements that are really unrelated to the task are pictures of animals and a confusing spatial layout. So the adaptation that could happen here is this adapted item. Now the birds have become circles, the dogs have become triangles, the cats are squares, and there is no confusing spatial layout. Everything was put in one row. However, there were attributes that were that made this item more complex, that we did feel we needed to retain. And that was the different shapes and sizes, the number for each object that was alike, and differences in color and differences in placement. So what ended up was, we do have different sizes of circles to represent, and different, these are the gray geometric figures are shaded. So they have some fill inside the tactile graphic. I guess I didn't mention that, I'm sorry. These at the bottom are tactile graphics. So they are raised lines that a person would feel going across. So the circles that are shaded, they have a fill in them, so they're still a circle, but they have a different texture. And so, so now we have multiple objects of different sizes and shapes. We're still asking the person to recognize which are important, which are to be ignored, and to count. So that's how this type of item was adapted. The fourth part of Principle 1 of test integrity was, would an adaptation change task demands, thereby requiring a different or more advanced skill, knowledge, or cognitive ability? And this came up a lot when we were looking at items with pictures, and there are a lot of them. So for this was the passage comprehension test, and there's a picture of a ball in a wagon, the type of a child's red wagon that one would pull. And the item, the original item, was written out. It said, something is in the wagon, it is a, and then there's a blank, and the person is supposed to be able to read the sentence or sentences and then fill in the last word that would make sense. So we're looking at, how do we adapt this? Well, how about if we just omit the picture? Then we have, the person would read, something's in the wagon, it is a, and they would fill something in. Would that be okay? Well, that would really be unfair. First of all, without, the picture gives a sighted person information as to what words are there. They don't have to be able to read the word wagon because there's a picture of a wagon. They don't need to be able to figure out what might be in the wagon because there's a picture of a ball. So without the picture, it becomes a much higher level reading task. So could we just describe the picture? Okay, then I'll tell you there's a little red wagon, it's got a ball in it. Now read this. Then I'm asking that person to hold information in working memory that a sighted person doesn't have to do while they read what's there on the page and then fill in the blank. Then that becomes a higher level cognitive task. And again, we're adding something that a sighted person doesn't have to do, or an ability that they don't need to use. So this was really unfair. So how do we adapt that? Actually, we only had to do this for one item, but this is what we did. we just used tangible objects and changed the item a little bit. So something is in the chair, it is A. And so what happened was we just had a chair, put a book on it, had the student read. So, she felt, had the student feel the book on the chair and then read the item and then fill in the word book. Now, the problem with this test, which is passage comprehension, or understanding what you're reading and filling in the appropriate word, is that the first 11 items were so tied to pictures, we just had to delete them. So now you have this test starting at item 12, which is more advanced than if they started at item 1. So somebody has to make a determination, can this person, the student, read well enough to start with item 12 and to get a basal starting at item 12? Well, who's going to make that determination? It's unlikely that the psychologist or the diagnostician, who may not know that student very well, is going to be able to make that determination. But the TVI who works with that student should be able to say, no problem, that person can start with item 12. Or, nope, it's just not going to happen. Item 12 is a little too high, we won't get a basal. Okay, and then you wouldn't get the test. We only use tangible objects for that one item, but what we were able to do for the other items that were picture-based or very visually biased, even if there wasn't a picture, there might have been information that we would expect sighted people to learn incidentally as they went through their lives, and people who are blind would not necessarily know that information. We were able to take items from forms B and C, the other two forms of the achievement tests, and just substitute items of the same difficulty level. In the Woodcock-Johnson, every item of every test in every battery has a norm-based difficulty level. And so the achievement test, there are 3 forms of the achievement battery. And so there's A, B, and C. So we were able to look for forms B and C and choose items that were similar, but were not so visually biased. Okay. So we'll go on from there. The last part of the test integrity, principle 1, was what foundational skills, knowledge, or experience does the performance of these tasks assume? And one test that is in the achievement battery is just a list of nonsense words. We want to see how well can a person sound out words that they've never seen before. So read these words. The original, early on, the earlier items on the original test were TIFF and ZOOP. The problem was, as we looked at what are the letter sounds that children, young children who are, or people who are new to Braille, what are they taught when they're first beginning to read? What sounds are they taught? What letters are they taught? And it didn't match the order in which most sighted children are taught. So we had to do an adaptation there to make sure that we were not being unfair or disadvantaging children who were learning to read in Braille. So we just adapted it so that we had nonsense words, and these are still words from another form, but these match what we were using at the time was Patterns, the primary Braille reading program, or Bangold to teach Braille. So we were going with their order of what was being taught. Story recall was another one you had to consider. So the task is, you say to the student, I'm going to tell you a story, and when I finish, you tell the story back to me. And what we're looking at is how good is this person's memory for what they hear when it's contextual language. So I'd like you to take a look at and listen to what happens here. Now, this little girl is named Donna. This was done quite a long time ago, so I actually talked with Donna the other day, and she is now 20 years old, but the video is still useful. And so I'd like you to listen to, she's listening to some stories, and then she tells them back.
All right, Donna, you're going to hear a story from the headphones. First, you will hear a single beep. Then the story will begin. When the story is over, you will hear a double beep. Then you tell me the story back to me. You ready?
Mm-hmm.
Okay.
Amy's dad said to not talk or the fish will swim away.
Okay.
There was a little spider crawling on the street, and he was afraid that about the cars, so he went into a little boy's shoe.
So at this point, I didn't record everything that Janice, the psychologist, reads to. Actually, Janice wasn't doing it. As you can see, Donna is wearing headphones, and there's an audio recording that she's listening to. And then once the audio recording is finished, then she tells everything she can remember. And to this point, she's done fantastically. She's sharing everything. So I'm going to move ahead to 111.
And then he walked safely. Rick got glow-in-the-dark stars for his 6th birthday. So he wanted to put the stars on his bedroom ceiling.
Okay, that surprised me, because how many children or people who are blind from birth know about glow-in-the-dark stars? You know, I was not expecting that Donna would remember that, but she did, and she got all of the information. However, I'm not sure that would be fair for all people who are blind. We are asking them to have some experience with something that they may never have had experience with. I'm going to go a little bit further and
All right, Donna, you're going to hear a story.
I have to move this ahead. Oh, well, never mind. I can't see the numbers at the bottom in this when I have it in this format. So we'll just listen to it.
A turtle, and she thought it was she was wearing magical glasses.
Something that
Rachel?
Something that she missed there was the fish were different colors, and she didn't tell about the different colors. And I'm not sure if she just forgot that, or if color just was not an important or as a salient information for that. Okay, so anyway, that the idea here is, if we're asking a student to tell back information that they've heard, it's a lot easier to give back information or remember information that you have some knowledge of, rather than information you don't know anything about. She did okay, so listen to this one. Wait a minute.
Has gotten something for her 5th birthday, and her dad taught her how to play, and she was the champion.
So she got a chess set for her birthday. And Donna didn't know anything about chess or what it was. And she left out, she didn't know much about championships or competitions. And so she left all that out. Now, she was in 2nd grade, 9 years old, so I wasn't really expecting her to have that information. A little bit about Donna. She had been, her family had moved to the United States from Mexico when she was in preschool. None of the family knew English. She was a Spanish speaker. She started working with her teacher of the visually impaired, Marcia Borg, who started working with her in teaching her English and starting to teach her to read. Marcia worked with her through 8th grade, and suggested that they hold Donna back in kindergarten to give her more time to learn English, which turned out to be an excellent decision. So at this point, she's 9 years old and she's in 2nd grade. Okay, so this story recall task really doesn't require any adaptations. The skill that it's intended to assess is the ability to retain and recall details and narrative information, and it's presented orally. She's using a recording and headphones. She's responding orally. So the only adaptations, there really aren't any adaptations needed, but in terms of interpretation, one might have to stop and think, was there information there that we can't expect her to be familiar with at all? And if so, then we have to look at whether or not, how valid is the score? Let's say she scored lower than we would have expected given her age, but she was reading something about a grocery store and she has never seen the inside of a grocery store and doesn't know how things are set up. Then we're asking her to do something that we're not asking most sighted individuals to do. And in terms of interpretation, we have to be really careful about not just assuming that she can't remember, that she has difficulty with memory, but think in terms of she never had that experience in the first place. Okay, so let's go ahead. We're talking about replicating standardized administration procedures. So in story recall, there was no problem. We could replicate the standardized administration procedures exactly. In Braille, we're looking at letter word identification. So how's the task administered? What does the individual have to do to respond? All we're doing is giving a list of words, and we're asking the person to respond by reading the words. This is a word identification skill. We're not expecting them to sound this out. What we want to know is, are these sight words for the person? Can they look at the word, read it, and move on? There's a for the original test, there's a 5-second limit to the time because we really don't want a person to struggle through sounding it out. The adaptation, we are administering it through the primary reading media, Braille. The response requires the subject to read the letters or the words. The adaptations don't change the task demands, except that we're presenting it in Braille. There are times early on in the test where the words didn't match the order that widely used Braille reading programs follow. And so we did switch items 3 and 4 with items 5 and 6, just so subjects would see lowercase items before they see uppercase items, since in Braille, they will learn lowercase items first. And the time limit was changed from 5 seconds to 10 seconds. And I ran that by Dick Woodcock in order to make sure that he felt that was fair. But reading Braille generally takes more time than reading print. And so that was, we and he considered that a fair adaptation. Okay, so the test has to be presented in either uncontracted Braille or contracted Braille. Okay, there's nowhere that makes sense to switch from uncontracted Braille to contracted Braille. So I want to show you something that happened with Donna. Okay, now I want you to listen to Donna, but watch Venetia. Venetia Hayden was the TVI that helped us do this videotaping. Janice Salmons was the psychologist who helped us do the videotaping. And watch Venetia to see how she is involved in the administration of this. Okay, and I have this set up so that I could switch to various numbers in the video, but in this format, I can't see the numbers, so we're just going for it.
Next page. Okay. All right. I think we're ready to get started. Donna, how about you?
I'm ready too.
Okay, good. Here comes a page in front of you.
All right, coming from my side.
Good job. All right, at the top of the page is the letter L.
L.
Find that letter.
Found.
Good job. This is the letter L. Next page. Okay. All right. I think we're ready to get started. Donna, how about you?
I'm ready too.
Okay,
I was
good.
trying to
Here
move
comes
us
a
ahead
page in
there.
front of you.
All right, coming from my side.
Good job. All right, at the top of the page is the letter L.
L.
Find that letter. Next page.
You lift and I'll come in underneath. There you go.
R. W.
Okay, hang on. Let me give the instructions and then you can start responding. You're doing a good job. You're so enthusiastic. All right, Donna, there are 6 letters on this page. Touch the letters so you know which ones are there.
B. S. C. A. H.
Okay, I want you to point to the letter I say. You ready? Point to the B. Point to the C.
Lift your finger 1 second. Okay.
Okay, next page. Good job. There are 6 letters on this page. Touch all of them so you know which ones are there.
R. I. K. M. U. Y.
Point to the I. Point to the Y.
Okay, coming under.
It is.
There, wait a minute, wait for the instructions. There are 3 letters on this page. Go ahead and look at them.
B.
Thank you. Next page. Okay, look at the 4 words on this page. Point to the word C.
Got it.
Which one is it? Pick one hand up and... Okay, now, yeah.
Skip down to the next line. What word is that?
On.
Okay, next page.
Prominent.
There are 8 words down the left side of this page. Find the first word. What is this word?
And.
Go ahead with the others, but don't go too fast.
Dog. In. Can. Ass. Gut. Was. Have.
Okay. So what she read as have was have, H-A-V-E. She pronounced it have. Was that an error? Well, I was driving from Tucson to Phoenix with my Braille books, with the new copies of the Woodcock-Johnson. This was the Woodcock-Johnson IV. And I knew that we would be testing a 9-year-old. And I figured a 9-year-old would not have much in the way of contractions. So I left the contracted test home and just brought the uncontracted test. Little did I know that by that time, Donna was reading fully contracted Braille. So when she looked at the word have, she didn't recognize it because it wasn't contracted. So she sounded it out. And if it were a nonsense word, she would have sounded it out correctly. And so that was my error, because not being her TVI, and I didn't check with Marcia first, I assumed she wouldn't be able to read the contracted Braille. So before we give a test like letter word identification or any of the words that require reading, somebody needs to look to see, is the student, which would be more appropriate, the contracted form of the test or the uncontracted form of the test? Because she made a mistake because I made an error. So we're gonna take a brief excursion out of Principle 2 and move over to Principle 3 because it has to do with Braille and it's very important. Before you start testing, you have to decide whether or not you're going to use contracted Braille or uncontracted Braille. All of the Braille is in UEB. So you have to make a decision. Are you going to use UEB Math Science or are you going to use Nemeth Code? And are you going to use contracted or uncontracted Braille for the reading? And you have to consider, well, how are you going to do that? Well, obviously, most psychologists or diagnosticians who don't work with students who are blind, they're not going to know where that student is in terms of their knowledge of contractions. And so what you want to do is you can go to the appendix in the manual, and every item that has a possible contraction in it is written there. And so the TVI who knows the student can go through and say, this student does not know most of these contractions in the test that she or he's going to take. So we'll use uncontracted Braille. Or this student does know most of these contractions, and it would be fairer to use contracted Braille. You have to decide, because within the tests, there's no place that it switches from uncontracted to contracted Braille. So you have to make the decision, and the entire tests need to be given either in uncontracted or contracted Braille. And that's the decision that the TBI is going to have to make. The reason that we did that is because educational institutions across the country vary in how and when contractions are taught, and individuals vary in their level of knowledge of contractions. So we couldn't make a decision as to where we would switch within a test. There's no logical point at which you could do that. Okay, now we're going back to principle 2, replication of administration procedures. So here's the test, sentence writing fluency. And the original test requires the student to look at a picture, read 3 words that go with the picture, and then write a sentence that uses the 3 words. And it doesn't have to match the picture, but of course it's a prompt. And they have the picture right in the book that they're going to write the sentence on. And what we're trying to see is how many appropriate and correct sentences can they write in, I think it's 7 minutes. So each item is a different picture and a different 3 words. But we're testing speed. How fast can you come up with a sentence? How fast can you write it down? Now, how do we do that in Braille? Well, the student would have to, first of all, there would be no picture. The student would have to find the item, the 3 words that they need to use in their Braille book. Then they would have to move their hands over to the Braille writer, write their sentence, go back to the Braille book, find the next item, find the 3 words, go back to the Braille writer. We are introducing a very time-intensive way of a time-intensive addition to their taking of this test that we don't ask of sighted people. So there just was no way to adapt this and to replicate the standardized administration procedures and still make it fair. Here's another one. Word reading fluency. The student is expected to read the first row of words and put a slash through the 2 words that are have an association. So it would be moon and sun on the first line, bush and tree on the second line. Now, how do we do that in Braille? Well, the person would have to read the first line, remember that he wouldn't have the prompt anymore, because once your fingers are not on that word anymore, you have to hold it in memory. So the person would have to hold in memory everything that came, decide which 2 words are associated, go back and find that word, and then tell, or else just remember those words, and then tell the administrator what the 2 words that matched were. So that adds an extra burden on memory. And they might have to go back and reread the words again, and that means moving their hands rather than just their eyes. And this is a speed test. How many of these can you do in, I think it's 3 minutes. So again, there was a standardized administration procedure that really was unfair if we translated this into Braille. So this test and the previous test were just deleted. There was no way to give them fairly. So tests of speed that required a written response were just deleted from the battery. Here is a different one. This was like speeded comprehension, speeded reading comprehension. So the question was, or the original task is, read the sentence, and then circle yes or no if whether or not the sentence is true. So it's fire is hot. If that's true, circle Y. If it's not true, circle N. This was easy. We just had the students read the sentence and then say yes or no. And that way the administrator could just mark if it's correct or not. So in that way, this was an easy adaptation. We just changed the physical aspect of the answer to oral. So we were able to keep this test. Okay, so we have covered principles 1, 2, and 3, and we're just going to go to a recap of what we've looked at so far. The adaptations we've covered are using Braille instead of print. For pictures, using tactile graphics, tangible objects, or substituting an item of the same difficulty level. For items that were clearly visually biased, we substituted an item of the same difficulty level from a different form of the test. We made written answers verbal. In some cases, deleted the item. In some cases, deleted the test. And because we didn't have the same number of tests anymore that the original clusters used, then new clusters had to be created. Principle 4 was produce scores with a consistent value across all test subjects. So that has to do with the norms. What do we do about the norms? How do we create scores that are fair? So the WJ4 Braille adaptation was not standardized on people who are blind. The scores were derived from administering the WJ4 Braille adaptation. I'm sorry, let me go back. The scores derived from administering the WJ4 Braille adaptation inform the examiner as to how a blind individual performs compared with sighted age or grade peers on tests that were designed for sighted people. And it just did not make sense to try and, for many reasons, to try and norm this on people who are blind, because a norming sample of individuals who are blind would not only be extremely difficult to obtain, just getting a sufficiently large sample without concomitant disabilities would have been just about impossible. But it would have lacked the usefulness for making educational decisions. We want to know, what do we need to do to help these people function in a world that's mostly populated by sighted people? And they are in classrooms that are also geared for sighted people. Where do they need help? Or where are they excelling and need enrichment? So the norms that we used were based on the original norms for sighted people, but they were the norms that we're using, the scoring tables that we're using in the adaptation were developed specifically for the WJ4 Braille. They were created by the same team that developed the original WJ4 scoring program, but they factored in all of the deletions, the substitutions, and they created new compositions of clusters. So we had the same team as created the WJ4 norms work the WJ4 Braille adaptation. Okay, principle 5, team administration and interpretation. You know, before I go to that, and we're pretty close, I think we're okay. I'm hesitant to take questions at this point, but are there any burning questions about the adaptations right now?
We are keeping things up thanks to Laura Lynn's assistance in the chat window. So I encourage you to keep going. It looks like we have 15 minutes left of our time
Yeah.
together.
Okay. So here are the competencies that we are expecting that are necessary for the examiners of the Braille adaptation to have. They need to have fluency in reading and writing Unified English Braille and Nemeth Code and Unified English Braille Math Science. They have to have knowledge of the subject's approximate level of knowledge of Braille and Nemeth or UEB Math Science. They have to have familiarity with the educational and medical history and life experience of the subject. And they have to have knowledge about the effects of vision loss on the learning and functioning of people who are blind. Now, I don't know too many psychologists who have those competencies unless they started out as a TBI. Consequently, valid administration and interpretation of this really requires a team approach. For the regular, for the primary examiner, and this would be the psychologist or the diagnostician who normally would be testing sighted individuals, the person needs to be qualified and competent in administering the WJ4 to sighted individuals and interpreting test results. You need that experience. That person needs to meet the specific examiner qualifications that are informed by the standards for educational and psychological testing that were done in 2014. And they need to be trained in administering and interpreting the WJ4 Braille adaptation to a person who's blind. In terms of the standards for educational and psychological testing, one of those standards states when the situation or test taker group falls outside the user's experience, assistance should be obtained. So if the primary examiner is not experienced and has knowledge of how to use a test and how to test people who are blind, it's incumbent on them to work with somebody who has that experience or has the knowledge that they're missing. Generally, a psychologist will do, we all have seen what psychologists do, I think, and so I don't need to go, into all of the details, but they administer the test, they note the errors, they calculate the scores, they interpret the scores and look for error patterns with consideration of the subject's behaviors during testing and information provided by the ancillary examiner. And in this case, we're talking about the TVI as being the ancillary examiner. And the primary examiner determines needed educational accommodations and interventions in collaboration with the ancillary examiner. Let's take a look at this. This, when Donna walked into the room, Venetia met her.
Hi, Donna.
Hi.
Come on in. Hi, my name's Miss Venetia. How are you today?
Good.
Oh, so you're going to come do a little bit of testing with us today?
Yeah.
You're all set?
Uh-huh.
Okay. I'll tell you what. Why don't you let me have your cane, and I'm going to kind of show you how the room's set up so that you know where everybody is and what your place is, okay? First, I want you to come over to your seat and just hang on right here a second. Across the room from us is Dr. Sammons. She's going to be here doing part of the testing, okay?
Hi.
Can you reach your hand across the table, and I'll have her reach her hand across the table, and you guys can say hi? Reach, reach, reach. Hi, Donna. Okay, so guess what? This is your chair, okay? And you know how you can tell it's your chair? I'm going to show you. You have the non-skid here, and on this table is a...
Braille.
Absolutely. Okay, so let's start the route here. May I take you by this hand? Come with me. Okay, so come on, follow, come close to me. All right, here's the deal. We have this long table here, and it starts right against this wall, Okay, now put your right hand on. Let's follow it around. My seat, Donna's seat. Reach in front of you. Because you're going to have to go around. Keep your right hand trailing. There you go. That's your kind of workstation with your braillers, correct? Okay, coming around. Okay. Okay, Donna, step up. There's a cord on your foot. There you go. Keep going. Go around. And you can come over here and feel. This is where Dr. Salmons is going to sit. This is her chair on the other side of the table.
To read Braille?
No, she's going to read print. She doesn't read Braille like you do.
I don't know how to read Braille like you do.
Well, I had to teach you.
I love that.
All right, so would you please put your left hand on the table and trail your way back to your seat for me, please?
Uh-huh.
Okay. And then sit in that chair and tell me if it's a nice height. I'm going to put a Braille writer in front of you and tell me if it's the right height that's comfortable. Remember? How you going to? That's it.
Okay. So this is not something, acclimating a person to the room this way is not something that most primary examiners would be familiar with. Here's something else that most of us would not be familiar with.
Now, Donna, while Dr. Salmons is asking you to look at something, and if I see that your fingers are in the wrong spot on the page, would it be okay with you if I came gently under your hand and just led this index finger to where you were supposed to be?
No.
You don't want me to touch you? You'd rather have verbal instructions from Dr. Salmons?
Yeah.
Okay, then that's how we'll do it.
Donna,
Yes.
just kind of like when we're reading and looking at things on paper, and sometimes I help put your fingers in the right place. Is that okay?
Yeah.
Can Miss Venetia do that to help you, kind of like I would?
Uh-huh.
Okay.
So what is the difference there? Did we not explain
I think
something
it's
very
just a
well?
misunderstanding.
Okay.
Okay,
So Don, let me explain. So let's say I'm going to put my hand over here. Okay, my hand is where your hand needs to be for the Braille. But you put, can I go under your hand? Actually, you start here. But guess what? There's a letter up here and you missed it. What I was asking is if it would be okay to come in gently and just say, "Oh, Donna, we have to start here." Is that okay? Okay, I won't grab you, I promise. I'll just lift, okay?
Okay.
All right, that's fine. Now, Donna, if I...
All right. So that's also something that we normally don't see as necessary, because we don't have to touch a person that we're testing generally. We have to bring this up also when we are handing somebody earphones or explaining to them how to use the audio. And so the role of the ancillary examiner in administration is orienting the subject to the testing area and the equipment, positioning the equipment, helping to determine starting points for tests, making sure that the subject's hands are in the correct place when reading or finding an item, signaling to the primary examiner whether a written response is correct or incorrect, since that requires reading Braille. Also, that person may handle the page changes during time-limited tests. They are likely to provide a written translation, or actually they need to provide a written translation of the subject's responses in Braille or Nemeth or UEB Math Science, so that you can look at those for error patterns. For instance, they would help ascertain the pattern of errors in academic skills that are specific to Braille and Nemeth code or UEB Math and Science. So if a student is having difficulty with recognizing spatial orientation, they might read just as have in the contraction, or read have as just. Or if they're having difficulty with where in the cell those dots are, an upper cell or lower cell, they might confuse the words just and was. If they're doing those kinds of things frequently throughout their reading, that's not something that I, as a non-Braille reader, would recognize, but it's important because it could indicate a disability. It could indicate a learning disability that we would call orthographic, and it needs to be addressed, and there needs to be an intervention. And that's not something I could pick up, but it is something I should be asking about. But it's the TVI who needs to be coming up with that information. So the ancillary examiner in interpretation is going to provide information that may add to or alter the interpretation of a score, distinguish between learning difficulty versus gaps in knowledge that's typical of blind people, or maybe caused by delayed training in Braille and Nemeth or UEB math, science, and collaborates with the primary examiner on educational accommodations and interventions. So key points to consider in interpreting test results are: 1, limited access to incidental learning leads to limited prior knowledge. Limited access to visual experience may lead to more limited knowledge of vocabulary. Limited access to both of those affects the depth of concept knowledge. And this type of test does not assess a major mode of learning for people who are blind, haptic. This is not a lack of intelligence. It's a lack of access to experience and information. And I will ask you, please, to read the manual carefully. It's a supplement. It's not a substitute for the original WJ4 examiner's manuals. It goes through everything, and you absolutely need to read the entire manual in order to be able to work with this test or these batteries. Assessment is helpful only if it's done with the appropriate instruments, administered correctly, interpreted with knowledge, and leads to appropriate recommendations. Okay, and that is the end of this.
That was phenomenal. Thank you, Lynn. So much information was shared with our audience today, and the chat window has been alive and moving. We have been able to address almost everything in almost everything within the chat window. So I'm going to pause things for just a moment